am Adalton Vilhena Stracci, Brazilian medical doctor specialized in blood cells with a background in biochemistry applied to integrative medicine within Pillar 2. I developed the Gothard inline system in dark field microscopy and the Bradford system in bright field microscopy. And we are presenting some updated research to the World Confederation of Doctors. Greetings to everybody. We are here to share with you in our laboratory some research regarding the keys for longevity from the point of view of blood analysis and the correlation with the fibers, or rather with the trabeculae, the iris fibers in naturopathic medicine, in integrative medicine, and also in biomolecular medicine. I can start with you already a work that is specifically about bright field microscopy, dark field microscopy, in vitro bright field analysis, and also in biomolecular iridology, where we study the iris fibers in relation to the inherent genetic structure that each person has. Continuing with our laboratory observation into the research done in our laboratory, I would like to show you that the dark field microscopy that you see, the biological terrain, often depends on you having unattached red blood cells, transparent plasma, with almost no toxic material, observing that there is no Headley pleomorphism in its pathogenic form, or rather, these pathogenic forms that are here show the advance of a pathology, the evolution of that pathology, and also to the efficiency of the metabolism in producing energy. Observe that these red blood cells are unattached, and their membrane maintains an efficient and elevated zeta potential, or rather, the electronegative charge of the red blood cell membrane may show that the retraction of these red blood cells will indicate good mitochondrial energy production. Look then at the in vitro bright field microscopy, and we see that there are no white formations and masses related to the cellular pseudomatrix. We can observe here that there is no elevated degree of oxidation. There is only a detachment showing that there are still some nutrients missing, but there is no pathology, nor any pathogenesis either. So, the metabolism is good, has normal efficiency, and is aging normally as well. What I want to show between bright field and dark field microscopy is precisely how we can check the level of detoxification and the good genetics that can result in a faster recovery. Observe that these red blood cells are unattached, and their membrane maintains an efficient and elevated zeta potential, or rather, the electronegative charge of the red blood cell membrane may show that the retraction of these red blood cells will indicate good mitochondrial energy production. Note that you have an excess of protein, a low HCl, or stomach hydrochloric acid, leading then to a lowering of the zeta potential, a lowering of the negative electromagnetic membrane, which causes an attraction in the stacking of these red blood cells. So the metabolic efficiency is decreased in this phase, and it shows that you also have genetics that are in functional disorder. Looking at the bright field microscopy in the in vitro analysis, notice the white masses scattered in the coagulated drop. Observe that these masses can indirectly indicate free radical formation, but also observe that the periphery of this in vitro drop in the bright field analysis is faded, that there is a degree of malnutrition and low production of antioxidants. Note that it is the same patient that is both in the bright and dark field images. Now observe this relationship that we made at the laboratory level of genetics in biomolecular iridology. The iris fibers are rectilinear and compact, so it has strong genetics and is able to have a good and speedy recovery. For the same patient, we have in the dark field image unattached red blood cells with excellent zeta potential, and therefore the metabolic efficiency of a healthy biological terrain. In the bright field, we will observe a normal fiber network without masses of free radical roots. It indicates a healthy analysis. Now let's see another patient with more fragile genetics showing in the iris of the eye. The fibers are irregular in their tortuosity, and in their spacing, and in their pigmented coloration. In this analysis of the iris, the fibers which are trabecular are tortuous, spaced, and have an orange pigment that can indicate that the patient was born with a genetic program not to eat sugar. It is all orange from a lighter iris, which is easier to see, and you can tell that she is allergic to sugar. Therefore, sugar is a trigger for inflammation. That body is in pain. In the dark field, there is a halo effect. And the stacking that we observe here in the toxic material is almost here in the center of the dark field image. It shows that there is a high level of intoxication, a low zeta potential, or rather, a low electronegative charge on the cell membrane that causes it to clump together and decreases mitochondrial energy production. In the same patient, the bright field shows a fiber network with a failure in protein production, and these whitest masses that are free radical roots may be indicating a high degree of oxidation. This patient has fragile health. Observe in biomolecular iridology when a constitution is weak, the rectilinearity does not exist. It presents a spacing at an elevated tortuosity. This orange color shows again that it is programmed not to eat sugar. Observe that it has darker areas that are stages of inflammation that are acute and overacute. Notice that these fibers also show a deeper nerve tension ring. So this person had, during their 48 years of life, much of it built up from the supermarket. It was built up from too much toxic material, too little fruit, and too little vegetables. So the epigenetic response of this patient may be actually a lot of pathology setting in. Now observe in the biomolecular iridology a strong constitution with rectilinear fibers without much spacing. Although we can't see a normal iris, this one has at least 90% excellent genetics. Therefore, genetically able to face pathology and recover more rapidly. One of the things that iridology is that it helps us to recognize the ideal pH balance. Let's remember that there it is fundamental that we have this subgaseous HCl that is precisely for protein digestion, to take in a calcium solution and to stimulate the intrinsic factor that we have in the stomach mucosa and the absorption of B12 from food. We perform a therapy with HCl in the Mafea system here in Brazil. Thus, it is the HCl at 3.7% or at 10, 20, and 30%, that we study this bioindividuality of dosage so that we see that everybody has a deficiency of HCl or hydrochloric acid.